Welcome to another episode of season 2 of Dr. G at the Heart of Healthcare. I have a special guest here, Rick Topete from Silverado of Escondido. But of course, this is a national company, so we're going to cover all the bases. Welcome to the show.
Thank you so much, Dr. G. So excited to be here.
I'm so happy we're finally doing this. Okay, I have a million stories. I know I'm only supposed to have one, but I remember when we met at at an assisted living event, and it's just been so great. I'm glad we finally made it to do this education here because you do such great work.
Thank you. It's an honor. It's teamwork makes the dream work, but it's an honor to be here and be a part of your show.
Yeah, yeah, and welcome back from your vacation too.
Thank you so much. Yes, good to be back. Yes, loved it,
Yeah.
but yes.
Yeah, so today, audience, we're going to talk about Silverado and the options they have with their Nexus program, but in the context of mild cognitive impairment. Many Americans have been diagnosed with it. Maybe your parents, maybe your grandparents before you are involved in their care. And then many times I see folks needing to make decisions when mild cognitive impairment has developed into full-blown dementia or end-stage dementia. And so the goal of here is to have everything in place. But first, let's just talk about Rick and your bio. Tell us about, a little bit about yourself and how you came to work for Silverado and about your career. Just a mini bio.
Well, gosh, I've been honored to be a part of Silverado for the past 13 years. My wife and I actually prior published a magazine for women. It was a lifestyle magazine here in Temecula, California. And the market changed back around 2008, 2009, as we all remember the mortgage crisis. And I had about a year to really take a step back and look at what was important in life to what I really wanted to do and really find something with purpose. My wife came across the opportunity with Silverado Memory Care. And I always remember back when I was a young man back in the day, I had worked with Father Scott going to visit seniors in high school. And I always had a love for seniors, but I never really followed through with it. Well, you fast forward years later, I came across the opportunity for Silverado and took an opportunity in July of 2011 with the Escondido community. And what I loved about Silverado was the passion and heart I saw right away when I interviewed, walking the floor, seeing the caregiver, seeing the interaction. And it really warmed my heart like, wow, I think maybe I could really represent this company. And I was honored to be hired in 2011. And really for the past 13 years, it's been my passion and heart to serve seniors. I think along those lines too, I had two relatives that came down with dementia, Alzheimer's. And it's kind of like if I knew then what I know now, to really what they weren't getting at that time. And then to fast forward years later, of course, which is a separate story, dealing with it with my mother. But I think the foundation that I love about Silverado is big on education, big on support, but really it's about family and bringing both the support to the family as well as supporting the residents when they come in the door. So it's been my driving force, like I said, and I just hit 13 years in July.
That's fantastic. Yeah, that's wonderful, and I'm so glad that we can, kind of unpack things because, I know folks, some people say, "Hey, I want to be in my home. I want to age in place. I never want to go to a home, a old folks' home, a nursing home." They kind of generalize those things, but I don't think they really understand the options out there. So I want to help people see what's available, especially when you're facing mild cognitive impairment and you know that there will be a trajectory of disease, along dementia. So let's just jump into discussing that. When we were preparing for this show, I love some of the things you said, like how there are activities there to spark life in a person and encourage them to live. I love, as a physician, how there's a medical model there. There are many places that seniors go, or many memory cares, where there's not the medical oversight that I think they need as, a mobile physician. And so, The other thing you said was about hope and perspective and about socialization with a purpose. And so I just want to dig into all those powerful and positive things as you tell us about the Nexus program and how that can help someone in their early stages of disease.
Yeah, well, very, very well eloquently said. I think what I love about the Nexus program, which became what it became, wonderful clinical team 10 years ago, ran by one of our vice presidents of clinical services, Kim Buttram. We wanted to find something that really stood out. And Nexus, I believe, in connection. And in definition, the program is an internationally recognized evidence-based program that's shown to improve cognitive ability in those in the early stages. So what does that mean? That means being able to bring a program that is going to allow hope, not only for the residents to be able to celebrate their life, but also to support the families that are trying to unpack their own emotions. And you touched on it with socialization and purpose. We absolutely do that through our Nexus program, through the different pillars, purposeful social activities. We have an in-house support group for our residents that are in the early stages, dealing with all those emotions. We're also dealing with cognitive exercise, doing Tai Chi, yoga. We have residents that will lead certain exercise classes, that gives them that purpose and passion to spark within them, as you said. As an example, I have a group of wonderful ladies that make bracelets. I take them out to the community. I'll come back and they'll go, "Gosh, Rick, did they like what we made?" I'm like, "Oh my gosh, Barbara, they loved it. They couldn't have loved it even more. Thank you, because it came from you." Or doing different types of activities that allows that spark. And I think the Nexus program allows us to be able to do that on a daily basis, from taking our residents out to enjoy life. I know we were just getting ready to take our residents out to go see Jersey Boys, to go into a Padre game, or a Sunday afternoon barbecue, where you're out there with your grandfather or your loved one having a barbecue with our team, having some burgers, flipping the burgers right there. We'll do that with the residents, engaging with the family. And I think what I love about Silverado is that we have come with a philosophy over the last 10 years plus and growing to different ways we can spark that life. And I think for the family caregiver that's at home, what I would say to them is, you're at home, you're tired, you're trying to find every avenue through controlling as much as you feel that you need to through guilt and stress, where there's an option there. Now, I'm not saying that Silverado is going to be the end all for everyone, but it's a great place to start, because it's going to allow you to not only find an option for your loved one, but also for your own stress, to reduce depression. Because we all know that early death sometimes will happen with the caregiver before the actual individual with dementia. And we've seen it over the years. So I think with the Nexus program, we really try to bring that purposely designed environment with each community across the country that's going to allow us to do what we do. The other thing you touched on, Dr. G, which is really important, because people can say, okay, you have a social model, great, you got engagement. What about the clinical side? How does that work? Because, I've had to send my mom out a couple of times, or maybe I'm at another community and they've sent her out 3 times. And I'm like, well, here's another ER bill. The thing about Silverado is we do the best of both worlds. We marry the clinical model with the social model. So we're able to ascertain in the moment with 24/7 nursing, LVNs, RNs, a medical director to understand med management, medications, what medications are appropriate, what aren't, a fall prevention program through Silverado to understand, working with our partners like Select Rehab in-house to minimize those falls. Now, could they still have a fall? Sure, but they could have that fall at home with their dog, with no supervision, and potential for UTIs. What's going on with nutrition? Are they wandering out the house at 3 a.m.? Are you getting a call in Colorado that mom wandered out because you're listed as a main contact for mom? So I think what I'm saying is that taking the social model married with the clinical, we're able to give them a warm, safe environment, but also doing everything a skill does, except select things like IV meds, tracheotomy. No, we'll work it to our partners. But it's about bringing, I say, peace of mind. And that to me is what I say to people. And if we can be a benchmark, maybe not always the right fit. It's about sitting down with the family in that care plan. And it's like, we're here for you, holding their hand and letting them know we are here. We want to understand, what have you been dealing with? Maybe you're sleeping 3 hours a night. That's not conducive to quality of life versus being in a community where your loved one is there, where you're able to come, barbecue, music, activity. That's why I love it. And I'll say this, and I'll give it back to you. People sometimes ask me, they go, gosh, Rick, you've been at Silverado 13 years in the marketing. You haven't really, I've changed roles a little bit, training different people along the way. I said, I've been in the same role for the most part for 13 years because the model works. The people are impassioned. Lauren Shook, our president and CEO, started with a vision as a young man back in Fairfax, Washington, when he worked with his aunt and uncle and saw what he saw and grew up knowing what he wanted and cared. And him and Steve Winter and God rest his soul, Jim Smith, built a model that we've been now doing and thriving for 27 years. That's my passion. I'll step back.
I'm all about passion and peace of mind for people. I mean, bravo to be a part of it. And you said 27. I remember I was at the 25th anniversary party. It's just beautiful. So listeners, again, you may be someone, you've been diagnosed with mild cognitive impairment. This is something for you to think about in your estate plan. Where do you want to live? Where do you want to be as disease progresses? You're still living, you're still with us. And I know if I had a choice, I want the best for myself. And so let's just talk about the different progressions of Silverado, like the different areas they can stay in that fit where they are in the process, because the goal is to have one home, right? For them to be there until the end of life. And so could we just kind of unpack that?
Sure, absolutely. I think one of the things that's most important about Silverado is that we are architected with a model that allows us to be able to serve those on the early onset mild cognitive impairment side. Great. Quality of life, engagement, activity. Absolutely. And we do that very well through the various activities. Our directors of engagement will work with our engagement team to provide that. But like anything, the disease will progress. And with it, there will be certain elements that will come with it. Sometimes there might be some select colorful behaviors, wandering tendencies. There might be speech impairments that will come with certain elements of the different types of the dementias they might perceive. And with Silverado, we try to meet them where they're at and understanding where they're at. When people come in, we will do a mini mental exam and try to ascertain where they're at. If they score at a certain level, we understand that, great, then we're going to make sure they're going to be a part of this group. Because how do I say this? If I speak Spanish and you speak Spanish, we're going to communicate, right? If I speak Spanish and you speak English, it might be a little more difficult. And what I mean by that is we're going to put our residents in the appropriate groups and still give them appropriate activities. So whether or not it's in the early stages or the middle stages, every 6 months, we do a reevaluation of where they are to make sure whatever group of activities that they can thrive in, that they're going to be able to thrive in that group. Now, some might say, well, my loved one is more mid to late stage, or their verbal skills are where they are. And I think, from where I'm at, I just rather have them at home with us. Well, okay. But then that goes back to the stress and all of that affects you as an individual caregiver, whether or not you're a daughter, a son, or a husband. It's about quality of life. So it's all about the different activities we do with music therapy and artwork. And a lot of times we'll do art activities where they can come in, and we actually have residents that will engage in maybe doing a painting that we will engage them in. Their verbal skills have diminished, but their way to express themselves through art is still there. And we have residents that will do that today. So we will meet them where they are, but also in doing that, making sure that we can give them that quality of life that's going to allow them to be able to be embraced. And also for the family who is able to come in around the clock and really spend that time with them, from maybe early morning at breakfast, having a cup of coffee and a donut or a healthy breakfast, all the way through dinner time, versus, well, I dropped them off, they're in a community, now I go home. No, we want you to be a part. And we really have programs that's geared. We have in-house support groups that meet monthly for our families to reinforce that support. So you touched on a really good point, Dr. G. I think one of the things that I and our team does when we meet with families is that, and you said it, it's about that proactive approach. I work with fiduciaries, estate planners, wealth managers, because they may be at different stages. But I so encourage families, make sure you get that power of attorney, durable power of attorney for finance, for health, healthcare. So you've got the peace of mind for your loved one and be proactive about it. Great. And then you can step back and go, maybe I want to put my eyes on a community or two based on where things might be. You don't want to be in that reactive mode. You want to look at your options. I always say that because, again, Silverado might not always be the right fit, but it's looking at communities and what is their environment? What's their clinical model? How do they treat residents? What's their readmissions back to the hospital? How do they really treat the disease on a day-to-day basis with engagement and activities? How do they handle people that might wander out? How do they deal with behaviors? These are all the little things that Silverado really sits down from a consultative perspective and from heart. So when a family comes in, we're putting a game plan together that's going to serve them, serve their loved one. And in most cases, we'll do a pre-call plan to lay out the expectations. So you as a daughter, you as a wife, know not only what we're looking to do over the next 30, 60, 90 days, but how we're going to do it. So you have a peace of mind going forward versus, thanks, Dr. G, we've got your loved one covered. We'll keep you posted versus, how do I say this? And God bless all the memory cares out there, some wonderful ones, certainly here where I'm at in San Diego. But I will say this about with the X factor of Silverado. Many communities may give you a map, guide you. This is our memory care. This is where we do engagement. Silverado gives you a compass. We give you a compass and we take you through step by step. And perhaps maybe that's why we've had some of the accolades we've had from the heart, from U.S. News Report's Best Memory Care to Advanced Dementia Institute, ADI, being accredited by the Alzheimer Dementia Institute, which is a very honorable award, but it speaks to the level of care that we bring on a day-to-day basis.
Yeah, I really, really, really like that because my eyes are being opened also about placement options because sometimes folks may move into a place and it doesn't meet their needs, for behaviors or things that are occurring. Or their health, and then they have to move. Again, I can't imagine how devastating it is to have to, the adult children already have a difficult time selling their parents' home or doing whatever they need to do to get things going. But to have to move them again is not the best. And so again, we're here so that you all can be proactive and plan ahead. You mentioned a medical director being there. You mentioned a care plan. All those things are wonderful and they can't be ignored when we're facing disease. I know some communities, something happens, 911, they could be 911 out 3 times a week. I don't think that's how someone wants to live. So again, try to pick a place that can serve your healthcare needs. That's what I want to drill in today. So once folks are in Nexus, let's say they progress more, are there different communities within the memory care that they can live in?
Yeah, I think the way we've structured our model is that we have a very, every community is a little different, but the way we're architected, because we're one level in Escondido, we have an area where all residents are, you have some that we have set up on one side, but with all the activities that come with it and more of the Nexus on the other side. But we all will bring them together for different activities, like when we have concert on the green and we have music and family. But I think that tight communication between our team, from our social worker to our resident service director, where we really marry and understand where is each individual resident, where we do the assessments and go, okay, they've progressed. So now we want to make sure, are they in the right programs within Silverado? And I think one of the things you touched on, which is really a good point too, is you talk about transfer trauma, where, some communities, all due respect, people will go, well, they're significantly cheaper. I go, well, They may be, but what are certain things that they don't have in place? As I mentioned earlier, if something happens at 3 o'clock in the morning, in most cases, Silverado is able to ascertain in the moment and diagnose and go, this individual is fine. There is no fractures. We are good. Let's put him back to bed, versus we're not sure and we send him out and we're calling the loved one. And I see a lot of families, my team has dealt with that a lot, where they're getting those phone calls, those frustrations, where they just want to be able to have them in a place where they can thrive, but also progress in a way where we're giving them quality of life. We're engaging them in activities. They're enjoying the music. They're enjoying the barbecues. They're enjoying the different things we're doing, whether or not it's Zumba, Tai Chi, or an actual activity to stimulate the mind. I'll give you an example. We did one back several months ago. I love this, where it was a back to school night. This, I think, like a year ago in our community, Silverado. And we had a resident, and then we married it with a professional partner, like a fiduciary. And then we asked them, tell us about what you would say to your grandson or granddaughter as they get ready to go back to school. Because it was back to school. Oh, well, my grandson and their grandson might be older, or maybe they were thinking about their son to be a good student. And I'm so proud of them. And they wrote these little notes that they would then put in a backpack to say, have a most amazing school year, and I'm so proud of you. So we put together all these backpacks with pens, pencils, and everything else, and then we took it to one of the local school districts with all these little notes that the residents wrote, but we integrated it with our professionals. So we're all about that education piece that's going to support our families along the way. And the thing that I'll say about Silverado is 3 things: enrich lives, educate, and encourage along the way. Those are the big E's that I say. And that's what we do with social and purposeful activities every day within the group. And when I look at it and I say to you, yes, we have the Nexus model. Yes, it's great to see the stories and the music and the dancing. And not to go off on a tangent, but I have a quick story. I had a resident a few years ago, gentleman, lady, his wife came in. Wife was a bit frustrated because they weren't able to find the right fit for him. And I said, well, tell us about your husband. He was a FBI agent. I said, oh my goodness. She said he was a police officer, did some different things. I said, okay, got a great idea. It's one of my favorite stories over the years. So we got him a badge, said director of security. And I sat him down, true story.
I love that.
And I said, Richard, we want you to become director of security for Silverado. So when people come in. So Richard and I used to work inside as a family ambassador doing family counseling. And he would sit down on Friday afternoons. He was always with me, had his Pepsi, his little sandwich. But he would usually go out for an hour or so, sit up front. We let the families know, people come in, and he was like Mr. Security. Mm-hmm. And it gave him purpose every day. And then Richard would get up and go, time to do my rounds, 1,800 hours. And he'd circle the community, back, sit down. And Richard would do that for the next couple of years. Where I'm going with this we found a purpose for him, and it brought joy to his purpose, but it brought joy to his wife. It brought joy to our team in doing it. And these are the different types of stories that, like I said, warms my heart. Or I think about the friendships, Barbara and Mary today, where people might sit back and go, and I'll say this, oh, my mom needs a private room. How is that serving the disease? Because what I tell people is, yes, perhaps a private room can be appropriate in some times, but in a lot of cases, if you can find that right person to connect them with, it's going to reduce anxiety, depression, and maybe build a friendship of purpose in doing activities together. And we have that great story in our community. And once you come back again, I'd love to introduce you to Barbara and Mary. And so I think of the Barbaras and Marys, I think of the Richards, and these stories are all over the country. And again, Dr. G, whether or not we're the right fit, I just want to be a resource to families and give them that resource and give them hope and options that allows them to celebrate their abilities of their loved ones, not focus on the limitations, but also instill hope in them that there is a path. So they're not sitting down this hopeless trail going, there's nowhere to go. I don't know what to do. There is a where to go. There is a place to go. And whether or not it's Silverado, we can assist you or at least guide you.
Yeah. So I'm a part of, some of the caregiving community on social media. Instagram is pretty big, some on Facebook. And I want to be clear with the listeners, we're not, dismissing or minimizing the challenges that you all face. What we want to highlight here is just pivoting that focus to the socialization and purpose that your loved one can still experience during the progression of the disease. I often hear people, or see posts, what a terrible disease. This is torture. This is this. What we're talking about today is how we can manage their life while they are experiencing it. And there can be quality of life instead of them, um, you know, deteriorating in a corner alone. We know that there's research about loneliness making disease worse. And so, again, I want to just offer an option to people to make their own decision with their estate planning so that, everyone knows this is what we want to do as my disease process progresses. And so I don't know if you want to say anything else about that, Rick, because we're going to land this plane soon.
Yes, no, I think you hit the nail on the head. I think really for me, what I tell families is you've got to take care of yourself. You got to put an oxygen mask on you. There is resources out there from Alzheimer's Association to other entities that you can look at, Googling caregiver resources, that's going to minimize your burnout, which is going to give you hope first to be able to decide what's best for my loved one. Obviously, if someone can be at home and there's some level of activity and of engagement you can do there, great. But you need to be proactive in your evaluations to be able to look at a path, and whether or not it's us or other elements from estate planning to fiduciaries, look at those resources that are available to you that's going to give you what you need proactively to support your loved one. And like I said, if Silverado can be a part of that, we'd be honored to. We've been doing it for 27 years. We look forward to continuing what we do, and I certainly will be excited to continue to do what I do, working with great people like yourself, Dr. G.
All right. Well, I thank you for that. Today's valuable resource is Silverado. Rick, I'll put, his LinkedIn in the show notes. The link to Silverado would be there, so you all can look into some of their programs in your area. You're probably not in San Diego. Everyone's listening from all over the country, but just so that you can look into this option for living with Alzheimer's disease or other dementias. So thank you for sharing today, Rick.
Thank you, Dr. G. It was an absolute pleasure to be here with you.
All right. Peace, everyone.